Mary Beth, hit record.
Good.
We're good. And we're going to start. So good morning, everyone. Facebook Live. Good morning, all you early risers. I'm Andrea Tarr. I'm the program director of SCAN. And you are starting your day with SCAN FYI.
Good morning, Andrea, and I'm Mary Beth Kwapniewski. I'm the program coordinator at SCAN. So welcome to SCAN FYI. This is a weekly Wednesday morning segment to start your day with some important information about our senior community. Today we're going to talk about SCAN's Benefit Enrollment Center, and with us today is Helen Kuron. And I'd like to introduce Helen, and she can tell us all about the Benefit Enrollment Center. So good morning, Helen.
Good morning,
Helen.
It's nice to join you and see you this morning.
Yeah, you know, thanks to Zoom, it's the only way we get to see anybody.
That's true.
Yeah.
So we are the BEC, Benefit Enrollment Center, the division of SCAN that assists seniors that are on Medicare or disabled adults to ensure that they have all the benefits that they're entitled to.
Okay.
What kind of benefits are you screening people for, Helen?
What we're screening for there are 5 major benefits, and that would be the Medicare savings programs, and that would, if the seniors are income eligible, they may be able to have their Part B premium paid for them each month. That's the $144.60.
Yeah.
And for a year, that's a savings of over $1,700, which is very significant. But we also screen to see if they're eligible for Medicaid, for assistance with their energy bills, food stamps, and just Part D prescription plans. And then there are tons of other plans, I should say other benefits that federal, state, and local, things like farmers market vouchers, you can get the EITC, the senior freeze. There are a lot of other benefits as well. But we do a screening to see, according to their income, what they might be eligible for, and hopefully we can get them for them.
So potentially that can add up to a lot of savings for someone.
It sure can.
Yeah. Now, who do you typically help at the BEC, or what is your target audience? So people listening know if it's for them.
Okay, they're essentially, if they fall within lower income range, and we can determine that because it's different for every program, we can determine that with the screening. That's who we're targeting, and again, it's seniors 65 and older who are on Medicare, and any disabled adults from 18 to 64. So that's our target audience, and again, the main thing is for them to be income eligible, and we would do that with the screening on the phone. At this point, that's what we're doing.
Yeah, I was going to ask, how are you managing that during this time?
Very creatively. We used to have face-to-face interviews with the people going to their buildings, senior housing, resource fairs, anything like that. It's been very unique right now.
Creative.
But we found so many ways to do it, and essentially the first part would be a screening on the phone, and from there we just figure it out because every person's individual. I've done a couple drive-bys where we pre-arrange and I just open my car window and they drop their things right in a plastic bag. We can do paper applications instead of online. So for each person, it depends. If they're able to get their documents to us, that's one thing. But if not, we find another way.
Okay. And Helen, are you working with seniors in both Monmouth and Ocean County?
Yes, we are. We currently have 3 benefit enrollment specialists, including myself, and we have one in Ocean County and another person in Monmouth County. That's Dory and Laura, and 3 of us cover those 2 counties.
All right, now I'm going to say this again later, but we are going to put the phone number to reach Helen in the comment section on Facebook, so you don't have to worry about memorizing it, but hold it up,
Okay.
hold it up. Talk about being creative, folks. This is what we're doing. So that's how you would reach Helen with the BEC. But again, we'll show that later, but it'll be in the comment section.
Okay.
Thank you, Helen. This is what we do. And here, like a little station break, you are watching Scan FYI live on Facebook. So, you know, just to show people what the BEC has accomplished, Helen, because it's not been around for that long at this point.
No.
Can you share some statistics on how you've helped folks?
Definitely. We started around April of last year, 2019, and we've been able to screen over 500 people. That doesn't mean they're all eligible, but out of that group, we were able to do applications for 245 clients in Monmouth and Ocean County. And by that, we mean we got applications in. A lot of times they're eligible for more than one benefit. So out of that 245 group of people, we put in 550 applications for different programs. And the value of benefits for that group, but this is 2019, was $345,000 so far. We don't have 20s added into that yet, but it will be more than that. But that's just last year. We were able to provide $345,000 back in their own pockets of money that they were entitled to, that they didn't know about.
Well, that's pretty huge. And if you're at a lower income level, a couple of $1,000s a year is going to make a very big difference to you.
It definitely does, yes. And one of the benefits, the PAD benefit, that saves money on their prescriptions. We've had so many people say that they weren't able to fill their prescriptions. They couldn't afford it, and they're sacrificing their health so that they can put food on their table. And then if they get the PAD card, again, that's different for every person depending on the medication they're getting, but that was giving them significant savings as well. So it changes their life. It definitely does when they have the extra money and they can do other things with it, or just get the things that they need to live.
Helen, I recognize that every client is different, but on average, what would that initial investment of their time be for a screening?
Okay.
Yeah.
Currently, I mean, I have to answer this currently. The initial screening can be on the phone, and their name doesn't even go into that screening. It's just some general questions. It could take, 10 minutes to get an idea of what their income is, and if it's worth pursuing. If they are eligible, we'll certainly pursue and go into more detail on what they might be eligible for. And then we can do the New Jersey Save application for them, or whatever application, fits their situation. That can take, at least a half an hour, 40 minutes, depending on how many pieces of documentation they need. A simple one, probably do in half an hour. If they have tax returns, and the more documents they have to produce, the longer it takes.
Right.
But I'm going to say at least an hour of time.
But that initial screening is 10 minutes just to get an idea of if they're eligible.
Yes.
10 minutes well spent, I think.
Yes, definitely.
Helen, after the initial screening, if someone is eligible, you would let them know exactly what paperwork would be required?
Definitely.
Okay.
Yes. Yes, there are some documents that are definitely needed. There's a list of 5 major documents. And then, as I said, if they did do a tax return, we need that, the cover of that. And they usually have it. Most of them have it. They just have to gather it up or find it. And then that's necessary to get the documentation. And what I usually do, screening them, I can send them by email or regular mail a list, so they have it right in front of them, and tell them what to expect. And that usually helps them get everything together. And I make sure they have it, so that we don't have any hang-ups as we go along.
So Helen, once again, how do people get in touch with you? We're gonna put it in Facebook comments, but hold up your phone number.
This is the number for our benefit enrollment center, and you can reach myself, Dory, or Laura on this line, and one of us will call you and make an appointment with you and do our screening and see what you could possibly be eligible for.
Thank you, Helen.
Okay.
You must find it very satisfying on a personal level to help people like that, because you're returning money to them that otherwise they'd never see.
The feeling is incredible. Like each time someone lets me know that they got the Medicare Part B premium back. They usually get 2 months of back pay on that, and then it's not taken out going forward. And they are so happy, and they share that with you. You know, all the people that call to let you know we're in our follow-ups. It's just so rewarding because you know you've done something that they might not have had any clue that they were entitled to.
Do you find that most of the people, Helen, don't even realize what they would be entitled to?
I'm going to say that's a mix. There's a mix to that. But a lot of people do not know. And what I found is if they're eligible for one thing, they're probably eligible for 2 or 3 others. So it's a whole package that they can get and get assistance. Some people already have everything. You know, they already know they have it. And they might be missing one thing. So we're able to you know, help them with that one benefit. But it's definitely a mix as far as that goes. But of course, the most reward is when you get the people who had no clue that these services were available to them.
Okay, very good. Well, any final thoughts on what people might want to know about the BEC, Helen?
I just say take a chance. Like call. It doesn't hurt. There's the
free.
initial screening is.
The screening is free. We should say
yes,
that.
It's all free, definitely free. And you know, why not? You know, if you can have extra money in your pocket, let it be there instead
Always
of someplace
better
else.
in your pocket than somebody else's pocket. Always. Okay, very good. In fact, just as a point of interest to our listeners, next week we're going to have Louisa Sala. She's from New Jersey Natural Gas, and she's going to talk about the energy assistance program from New Jersey Natural Gas. So it's a perfect kind of a follow-up with, you know, everything that we talked about today. Again, there's so many benefits out there. They don't do you a bit of good if you don't know about them. So absolutely give Helen a call. I know she'll be great as far as helping you. All right, I think I think we're good for today.
Information, yes.
Yeah, a lot of good info.
Great.
My tea is still warm.
And Helen, just also on our SCAN website, we have a tab about our benefit enrollment center if people want to do additional reading on their own.
Right.
Okay.
Right. Okay.
Yes.
Well, you know, thank you, Facebook world, for starting your morning with us. Much appreciated. Special thanks to our guest, Helen, from the SCAN's BEC. Again, you've been watching SCAN FYI, Wednesday morning live at 9 a.m. Remember, if it's important to you, it's important to us. I'm Andrea Tarr. We'll see you next Wednesday, along with my co-host, Mary Beth, 9 a.m. Have a good rest of the week,
Have
everybody.
a good day, everybody.
Yeah, have a good one.